Associate, and today we're going to be teaching you how to insert a female catheter. Before stepping into the patient's room, you would make sure that they do have an order for the catheter and ensure that you're putting on any extra PPE if needed. When you walk into the room, you're going to sanitize your hands. You're going to ask the patient to verify their name and date of birth. Hi, my name is Hannah. I'm going to be your student nurse today. Can you please verify your name and date of birth? And it's correct. And then we're going to tell them what we're going to be doing today. We're going to be inserting a catheter for you. You're going to raise their bed to an appropriate height. And then I'm going to put their railing down. I'm going to put my gloves on.
Okay, this was confused about me. I'm like, it's supposed to be a hole.
And then we're going to uncover the patient
On Snapchat.
to where we need it. We're going to make sure that their legs are spread apart. We're going to take our pad and then we're going to uncover the patient. We're going to ask them to slide up if they can, and when they do, you're going to slide this under. So now we're going to bathe the patient with warm water and mild soap. And we're going to wrap this around like a mitt. Using the warm water, we're going to go downwards on each side. We're going to use a different side of the cloth every time we do it. And then we're going to open and go down. Let her dry off. And then we're going to grab our Foley kit.
3, 2, 1.
We're going to sanitize. We're going to open our kit and we're going to put it right here. We're going to make sure that the catheter is the right size, ordered, and it is. We're going to take our bag. For our trash, we're going to put it over here.
Then we're gonna walk into the patient's room.
Next, we're going to open the kit, making sure we keep everything sterile. And then we're going to grab our gloves. Good.
And just to let you know, if for any reason you are in respiratory distress, just raise your hand and I will stop the patient.
Okay, and once you have both gloves on, you can move them around. Then we're going to open up the next pad. Put this under. And you can have extras. We're not going to use all of them. We're going to make sure our patient's allergic to iodine or not. And she is, so we're going to throw our iodine away. We're going to open our peroxide, put it in here, and then we're going to put our cotton balls in. Throw this away. Then we're going to open our lube and put this in. Throw that away. Then we're going to open the catheter and set this in the lube, so it's about 2 inches in at the tip of the catheter. And then we're going to take our cotton balls that have been soaking in the peroxide and we're going to wipe downward on each side. So like this. And then before opening that, to clean it with the peroxide, I'm going to take the cap off of our thing. And so now this hand is no longer going to be sterile because we're going to open and clean with the peroxide. And the hand has to stay there now. So now I'm going to tell the patient that I'm going to insert the catheter. This may be a little uncomfortable. Please take a deep breath. And we're going to find the correct place to put this. And once it's in all the way, you're going to inflate the balloon. And once inflated, you're going to remove this off of here. And you would tape the catheter to the leg with enough room for them to move. And then we would hang this on the side of the bed. And then this is for collections. If you're going to take collections from the urinary bag, you put them in here and send them to lab. To remove it, we would make sure that the patient's clean. We would untape the catheter from the leg. And we would ask them to take a deep breath. Make sure that the balloon is no longer full. And once they take the deep breath, you would pull it out and scrunch it and discard of it.